My name is Jordan Rosenthal. I am a member of the steering committee of the Correcting Crisis Intervention Today Coalition. Thank you, Ruth, and everyone else. We have some amazing steering committee members here today and people who are working as well in this field, such as Christina, who has her own organization, PCIT, that she's moving forward, and Erik Bottcher. Yeah! Woo! And with that,
good morning, everybody. Is this working? Great. Thank you so much for this opportunity to allow me to moderate this very important discussion. My name is Erik Bottcher. I'm the council member representing the Village, Chelsea, and Hell's Kitchen in the New York City Council. I'm a member of the Committee on Mental Health, and it's my honor to be here with so many incredible advocates doing so much important work in this field. The reason why I've decided to make mental health one of the topics that I've been speaking out about is because, number one, it's something that is affecting our city. Thank you. Something that is affecting our city unlike any other issue. I don't need to tell you how much of a crisis this is. You don't have to walk far in New York City to see people suffering from untreated mental illness on the streets. And to me, it's unconscionable that in the richest city, in the richest country in the world, that we're letting people die on the street from untreated mental illness. And this is a result of decades of failure as a country, as a state, and as a city on the topic of mental health. And we're now seeing the results of that failure. It's also a personal issue to me. When I was 15 years old, I spent a month in a mental health hospital in upstate New York following a series of suicide attempts. I was sent to a place called Four Winds Hospital. I see heads nodding. And at Four Winds Hospital, I got the mental health treatment I needed. I was sent there, 15 years old. I'm from a town in the Adirondacks outside of Lake Placid, New York, Wilmington, New York, population 1,300. And I was sent to Four Winds Hospital, and I was there with other young people from around New York State, victims of sexual abuse, physical abuse, substance abuse, depression, gang involvement. And you know, here I am, this kid from the middle of nowhere, exposed to all these folks from different backgrounds and getting the treatment that I needed. And that was the beginning of my political awakening and why I believe that I'm here today. But it was also where I got treatment that so few people in this country get. So few people get that kind of treatment, particularly if you're poor or if you're a person of color in this country. That's one reason why we are facing the crisis that we're facing. So we need to fix that, and we have people here today who are doing this amazing work that I'm honored to introduce. Ruth Lowenkron is the Director of Disability Justice Program at the New York Lawyers for Public Interest, and is a member of the steering committee of the Crisis Intervention Today. She has been active in the field of disability law since 1981, and she's assisted countless people with mental, physical, and other disabilities via impact legislation, litigation, legislative advocacy, and community outreach. She is a New York State Special Education Independent Hearing Officer and an adjunct professor of disability at Seton Hall Law School. Thank you, Ruth. Christina Sparrock is a certified public accountant, mental health advocate, and a person who lives with bipolar disorder. She's been appointed to Brooklyn Borough President Antonio Reynoso's Mental Health Task Force, and she has designed person-centered mental health response pilot in Fort Greene. and we'll be talking about that pilot today. Felix Guzman is a peer specialist with person-centered intervention training, social well-being team. Hope I got that right. And where they are working on peer-led, non-police responses to mental health crises. Please join me in welcoming our panel. So Christina, tell us what got you into this work? Why are you advocating on such an important issue?
Thank you for asking me, City Council Member Bottcher. So can you guys hear me? Clear? Hello, can you hear me? All right, I'm gonna talk right into the mic, okay? So 2 incidents have occurred in my life that it caused me to be an advocate. One was basically when I was at my girlfriend's house, probably like 6 or 7 years ago. And I went to visit her house because I was getting my apartment renovated in Brooklyn. And we were like, you know, from high school and college, we were like ride and die chicks. We did everything together. But when I came to her house this time, things noticeably changed. Her behavior was different. She had, her emotions were all over the place. She would yell at her husband, beat him up, just verbally abuse everybody around her in the house. And so we lived in fear. Her sister was there too, and her two kids, nephews and nieces, two nephews, right? But when I went to her husband to say, look, you know, this particular, you know, she needs some help, he said, no, we'll just go for yoga and for marijuana. I was like, yeah, right? And so there was a lot of denial, and they didn't accept that things were going on in her life, and she needed more emotional support than they didn't want her to have. So one day there was an incident. So I was in my house in the bed, laying on an air mattress, and I text her about her mother for something. Nothing hostile or anything. And she came down, really hostile, and ran into the room and assaulted me. And then started calling me a bitch, I'm gonna F you up, and all this stuff like that. So immediately I started crying. Her husband ran into the room, grabbed her. Her sister came in, grabbed her too. The two nephews ran down, hysterical crying. And so it was just chaos at that moment, for that moment. And as a person, I felt, oh my God, I got assaulted. I'm not symptomatic. I was afraid. So what I did was call the police, 911, right? I wanted someone to support and help me. So in my opinion, I was like, well, police are supposed to help everyone, right? And I thought because I had a disability that they would come and swoop in and be my hero. Like they would help like senior citizens with care and compassion and like children. But when they came to the door and came to the house, they responded to me as an emotionally disturbed person, an EDP. And that's what they refer to people who live with mental health conditions, an EDP. We're not people. But meanwhile, who was the victim? I was assaulted. I was afraid. So the police allowed her husband, who threatened my life at the same time, to file a false police complaint against me. I wasn't allowed to file a complaint at all. They didn't even investigate, and she was allowed to flee the scene of the crime and did not even get arrested. And this is the reason why I advocate. Because my human rights people who are living with mental health conditions should have rights, and we should not be deprived of our rights. The second incident that happened was most recently during COVID, was when I had a domestic violence relationship, and I had a wellness check, right? So, and of course the police department knows my medical condition because they have taken me to the hospital prior to that before. So, but when they came to my house, which I didn't know, I heard banging and banging on my door. I live in a co-op building, right? And so I'm sitting in the house, crime is up, things are going on. And so automatically what do? I grab a knife. Because when you're scared, it was a fear, flight, or freeze response. So I grab a knife, ran into the kitchen, and the pounding kept banging. It was louder and louder, and so I was afraid. Eventually it stopped. I called the doorman. He was saying it was the police doing a wellness check. And I was like, my God, why do people who call for health or mental health get police, but people with other medical conditions get a visiting nurse or public health response? Well, let's play this out differently. If my door was unlocked, what would have happened? Right, would have been shot. The body cam would have showed a so-called EDP, deranged, out-of-control person with a knife, non-compliant, police were afraid. I would have got shot and killed 20 times, right? Shot 20 times, and then it would have been justified. And the media would have played out, oh yeah, another person who's sick, emotionally disturbed person, blah, blah, blah. But meanwhile, no one asked me my story. There's two sides of the story, because I was defending myself because I was afraid. And I had a right to protect myself in my own home. So that's why I advocate. Thank you.
Thank you so much. Thank you for sharing your story, Christina. We're so happy that you're still with us. That is, and thank you for turning your experiences into something that could help so many other people. Ruth, we just heard about Christina's experience, and there's been a lot of talk in recent years about changing the way that we respond to mental health crises, to take police out of the equation, to put mental health professionals into the equation. At the end of the de Blasio administration, there were some pilots announced, there was some movement made. Tell us about these actions, what you think about what the de Blasio administration has done, what the Adams administration is doing. Have they done enough? And is this approach still problematic?
So how many hours do you have? I mean, I could answer it almost the opposite. I could say, well, there are only a few words to say, and that is that the system is absolutely broken, as you can tell, no doubt from your own experiences, certainly from what Christina tells you. And sadly, there are very few efforts right now at the city level or the state level to improve matters. And that's why we are very, very active at the organization, the coalition that Council Member Bottcher membered, Correct Crisis Intervention Today, New York City. I myself found Correct Crisis Intervention Today, New York City when I first arrived in New York to litigate at New York Lawyers for the Public Interest, and literally on day 2, one individual, and you may know her, Deborah Danner, was killed at the hands of the police when experiencing a mental health crisis. And if your skin was not creeping when Christina was talking, because doesn't that just sound exactly familiar? Somebody found with a knife, and that's that. And that was Deborah Danner's story. That's that in moments. And to say nothing of the fact, when I heard about that and the horror and what can be done about this, who's working on this, and all roads pointed to Correct Crisis Intervention Today, New York City, one of the thoughts I had too was, oh my God, Deborah Danner, African-American, middle-aged woman. Does that not sound familiar to at least the older people in the room? Does that not sound exactly like the Eleanor Bumper story of decades before? We're still doing that? And that, I know that's not what you asked me, like what got me into it, but I'll tell you, that's what got me into it. And what we're doing at Correct Crisis Intervention Today, New York City, is ensuring that we do have a way to respond to crises that do not involve the police. So we have put together a model that we'll be discussing today, and to utilize Council Member Bottcher's words, it takes the police out of the equation entirely. Now, yes, if there is some sort of criminality involved, you're going to get the police. Some may say you shouldn't get it then. Some may say there's no need for police. We don't take a position on that part. But what we say is that when it's a mental health crisis without any kind of criminality attached to it, you deserve a health response. It's really quite simple, as Christina articulated it, right? As one of our colleagues, Carla Rabinowitz, would say, you have a heart attack. Do you get the police? No, you get the ambulance, you get the EMT, you get the health response, and it's the same here. So what, in a nutshell, and I'm sure we'll engage on this more, we have this excellent idea. And why can I say that with such bragging and such confidence? Because we didn't make it up. We took our idea from the cahoots model that many of you have heard of, if for no other reason because it was featured on Trevor Noah. but Cahoots has been in place in Oregon for over 30 years with an amazing track record. Please write this down, because when you talk to your friends, and perhaps more importantly, when you talk, oh, I didn't actually mean to hit you, when you talk to your legislators, you are going to say, I know a non-police model works because this is what happens in Oregon. For over 30 years, not a single injury to any person with mental health issues they were helping. 0, 0, 0. And by the way, not a single serious injury to any of their staff either. And let's just compare that for a moment to New York City. I had the video up there. It'll probably come up again. In the last 7 years alone, there have been 19 individuals killed at the hands of the police in New York City when having a mental health crisis. Really, pause. I'm not quite sure what the next sentence can be, other than to let you know what you also have probably guessed, that the majority of those 19 people, 16 of them, are black or other people of color. So it's the double whammy if you are a person with mental health issues and also a person of color. And we have had not only those horrific deaths that we are counting, and still counting, sadly, the last death just in December 2021. But there are also, you can only imagine, and it's true, multiple serious injuries to individuals shy of death. You have people, because the police are called, who are arrested and become involved in the criminal legal system, who should never have been involved in the criminal legal system. And you have individuals who are forced into psychiatric hospitalizations against their will and also more traumatized by that. So that is not the way to do it. The way we suggest, and again we'll talk about the model to get the police out of the equation, is the way to do it. The city has finally come up with something. It's the Be Heard model, and you'll be hearing a lot about that today too. It ain't great, and that's another thing we're going to put on our list to talk to, or that's our goal when we talk to our legislators. Thank you, city. Great try with Be Heard, but it just ain't the answer. That CCIT model that Ruth Lowenkron, Christina, Sparrock, and Felix Guzman explained, that's the one that is going to do the trick, and I'll talk about that when you're ready to hear more about it, Council Member.
So Ruth, I want to ask you, Felix, about peer response, but why don't you give us a quick rundown on this alphabet soup of different models that are going on right now? Because even my colleagues and I get confused about which model is which, because you've got like HEAT, Be Heard. How many are there, and what do they all mean?
Okay, so I think we're going to simplify things. We're going to talk about two models. We're going to talk about the Be Heard model, and we're going to talk about the CCIT NYC model. Why? Because those are the real crisis response models. Any other model the city has through NYC does not respond as if it's a crisis. And that's what we're talking about. If somebody has some mental health issues and you can talk to them quietly and suggest perhaps some treatment here and so on, with the parenthetical, of course, our treatment is not so great in New York City either, and obviously we have to improve that. The better the treatment, the fewer the crises. The better the treatment that's available if you do have a crisis means less of a crisis, or a crisis that passes quickly. So putting that aside, I feel, and I hope you don't feel I'm evading the question, that let's focus on those two models. Because right now, you have 911 that responds to a mental health crisis. You have the pilot Be Heard program that responds in a few precincts in a manner that's problematic, and then you have our proposal that is the answer. So
with
details on Be Heard?
Yeah, so with Be Heard, a 911 call gets dispatched to that 911 dispatcher makes the decision on who responds. And if the 911 dispatcher, if it's in one of those precincts that currently has it, a team responds that includes a police presence and mental health specialist. Is that the idea with Be Heard?
No, not exactly, and in that sense, I give it a little more credit. What you described is something known as a co-response model, and that is something that we do not favor. Co-response meaning a police and some sort of a health practitioner. We don't endorse that model because we know what's going to happen. Here's the visual. Police forward, health practitioner backwards. So they are not going to be able to fill their role, and we don't see a need for the police. Again, 35 plus years of the Cahoots model says you do not need police. They have a team of an EMT and what they call a crisis worker. By the way, very, very important, that crisis worker in the Cahoots model, here's the only place where we have a little difference with Cahoots. We say in our model that that crisis worker must be a peer, must be an individual with lived mental health experience. Not just any peer, one who's highly trained. They train them 500 hours worth at Cahoots. We intend to do the same. But that's the person we think should be there. But here's the other little fact you're going to write down when you say how great Cahoots is and that we're following Cahoots. 70% of those crisis workers self-identify as peers, so they're probably even more peers. So even though they don't mandate peers, they have peers in the Cahoots model. So the way it works with Be Heard, if somebody calls, first of all, you cannot call and request Be Heard, God forbid, right? Because think about it, how Christina tells her story. If she knew there were another number to call, if she knew there were a Be Heard model, would she not have called them? Actually, in your instance, it's a little different because you were thinking of you were the victim of crime and so on. But another person who's experiencing a mental health crisis, you'd want to call that crisis team, but you don't have that option, which is a major problem. So what you do, or a family member who wants to call, thank you. So what you do is you still, under the Be Heard system, if you're lucky enough to live in one of the very few precincts where the Be Heard pilot works, you still call 911, as you said, Council Member. Then 911, which is a police-run dispatch system, they do the triage there, so you can imagine, and you'd be right, that they're using their police thinking about the problem that has always needed, from their perspective, police, and who only knows what this silly old pilot is. So we're going to send the police. My imagination, no. Statistically, the Be Heard program is still sending over 80% of the time police. As my mother would say with exactly this inflection, that's a non-police model? That's a police model. So, to finish my sentence, and I would stop talking, what happens is you still have to call 911. The triage is done at 911. If they do determine those 18% of the times, and that's only for a program that's only open 16 hours a day and only in a few precincts, then they send a totally non-police team, which consists of an emergency medical technician who's an employee of emergency medical services, which we also see as a problem because those individuals have been part of the problem in the past. They are sometimes dispatched with the traditional 911. I can tell you from our lawsuit, each of the 5 named plaintiffs had issues with the particular EMT who was an employee of EMS. So that's one problem. And then they send a health professional, but not the police.
Great.
So I think I finally answered
Yes,
your
you
question.
did.
So
Thank
I'll
you.
finally stop.
The peer model, Felix, tell us about your program and the peer model that it works with.
So hi everybody. So my name is Felix Guzman. I am formerly incarcerated, formerly homeless. I have to say that because I don't look like the apparent stereotype of those designations, and as a result, I take a very abolitionist perspective and framework on how I provide peer support. looking into non-carceral alternatives and approaches, such as the alternatives to suicide, which actually approaches suicide as an highly emotional state and not something that a person cannot have those kind of intense emotions around, and also just intentional peer support and so forth, and looking into getting training for moral recognition therapy as well. Because for me, I know that during my failures to be, for lack of a better term, well, in those highly emotional states, in that trauma impacted state, I was it was not necessary for me to encounter a police officer in that kind of state, nor to be looked at as not being a proper, not knowing how to make myself safe. You know, forced hospitalization is traumatic, and you know, having a police encounter when you're in a highly emotional state, that just it does not work. To see people in uniform, black gloved, if need be, sometimes with riot shields, that kind of response where you're flanked and surrounded and being talked to in multiple times by different vocal tones and so forth at the same time, to me as a pacifist, having to de-escalate that encounter when I'm already kind of a little unwell takes some severe restraint, and for me to have to feel that the alternative is, you know, death. I think that when I talk about peer support in the person-centered intervention training social well-being team model, which is a pilot program started by Ms. Christina Sparrock, as an example for the CCIT initiative, it actually has 2 peer specialists who are on a team who are basically I don't want to say patrolling because that's very carceral, but going touring the park. Yes, I apologize. I'm talking about my life, so I'm a little flustered. But we go around the park and we actually encounter persons who might be experiencing being unhoused. That might look like just having a conversation with anyone, because you know there's no telling anymore who might be unhoused, or who might be someone with mental health challenges or formerly incarcerated and so forth. So again, we go ahead and we, my partner and I, we would connect and try to provide peer support, orientation around services in the area, and or around housing rights and so forth. So I think in taking that comprehensive approach and actually being able to talk to someone, not from a adversarial position, but as just like a community member that's concerned for their safety, their well-being, and just how they're experiencing their life. Again, because mental health, I think the statistic is 1 out of every 5 people have a mental health diagnosis. I think that you know, as we look at that statistic, we have to realize that it's something that needs to be addressed in a loving, kind, compassionate way, so that people are not forced to not want to be open about needing help or assistance. And again, the PCIT, person-centered intervention training social well-being team, is a model for that. It's actually partnering people with lived experience who are actually taking the initiative to go ahead and get trained in these abolitionist frameworks, so that crisis can be addressed in a loving, kind, compassionate way without having that trauma at the forefront. So at this point, I'm gonna turn it over back to Erik. Thank you.
So thank you so much, Felix, for sharing that. Felix, could you tell us about some of the on-the-ground experiences you've had with this model and the success that you've had in Fort Greene Park?
So it's important to note that because homelessness is an epidemic, and it is a public health crisis, and it should be treated.
Can I explain the model first?
Yeah, I was just pausing it.
Sure. If Christina, explain this model that he is talking about.
So my name is Christina Sparrock, and I am a mental health advocate, and I'm also a person with lived experience. So I created the person-centered intervention training, which is separate from CCIT. The mission of the training is to improve the emotional well-being of everyone, We don't want to criminalize people because everyone lives with some kind of mental health condition. We also include supporting people who are just as involved, unhoused, living with mental health conditions, and who have substance use disorders. We train people to utilize person-centered, trauma-informed, culturally humbled approaches when engaging people. What's so unique about the PCIT program is that it's a prevention and intervention model. Too often we focus on crisis, 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 crisis. Why are we waiting for a crisis when people can get the supports when they need right away, right? When we're in crisis, that's when police are involved, and we're a non-police response. It's a peer-driven response model where Felix, like himself explained, he and another peer would go out and support the people. We call them park patrons in Fort Greene Park. So what's also good is that we respectfully engage people who are well, becoming unwell, and in crisis. And so what it looks like, it's like if I'm having a conversation with City Council Member Bottcher, and he's very well today, and I've known him for a long time, and eventually he may end up knowing my first name, and he want to go for coffee, and eventually he may say, you know what, I know somebody in my community who needs support. Will you be available to help them, because I don't want them to escalate? So it's that conversation that we have, that one-on-one, developing that rapport with him, and him having trust in me to engage with someone else to give them the supports they need before they get into a crisis mode, or before police get involved. That's our job. We're the prevention team. We're the Power Rangers. So we do not criminalize people. So again, we divert people from the criminal legal system to treatment and care, and we give people supports they need, whether it's like it could be housing. Like because we assume that when people are in the park that they need to be housed, they may not want to have a home, they may just want to have a blanket. So we actively listen to what people's unmet needs are. And for an example, we learned that people in shelters, they get robbed. I didn't know that. A lot of people do not have their IDs. So we even help them with the very basic things. Because I had my, I'm like, well, you don't have an ID? I was like, oh, they don't have an ID? I take things for granted. I can't. We have to be open-minded. We have to be trauma-informed. And listen to what people's unmet needs are and help them, right? Because that's the part of starting to help them with their recovery, right? So the training that we have is 35 hours, right? I know it sounds long, right? But when you think about the police CIT training, it's called crisis intervention training. It's actually 35 hours too, but they train people using the EDP version, emotion disturbed people, as opposed to we train people on person-centered approaches, right? We use peer experts as part of the training also. So we use people in the community to train, because we look bottom up. So we have people who with lived experience part of the training. So Felix was training. Ruth, who's a lawyer, is directly impacted too, because she has people in her family who lives with mental health. We want people who understand to be training the community. We want people to understand what it looks like, right? We also teach in our classes social determinants of health, because people they're like, well, why you got a mental, that's your problem. No, you need to understand the experience that people go through, how they live, the trauma they experience, and why they are today, and why they need the supports, and for us to not judge people. People are people. We have crises in our lives every freaking day, right? And so we teach about cultural competency. We talked about the various barriers and systems that we all navigate through family court, people getting their children taken away from them. Of course, when you be in trauma, you got your children taken away from you. COVID, someone dies in your family, you be bugging out, right? And so it's, we talk about mindfulness. Felix teaches mindfulness exercises too for the community. And so with the mental health response in the park, so Fort Greene Park, so we take this training. We took it to Fort Greene Park, right? We trained the park officers, the park staff, right? And like the community members. So it's a community-based program. And to me, to have a successful program, who do you need? Everybody involved from the ground up. The pastor, the reverend, the community, the park officers, the park. Because those are the people who know who are in crisis, who need help every single day, right? We got $225,000 from Van Emeren Game, which was great, private funding. So it was a collaboration between Fort Greene Park Conservancy, Fountain House, and the Parks Department. And when you think about COVID, the park was a refuge for everyone. We were all bugging out. We all had to stay in the park because we couldn't stand our loved ones in the house. We zoomed out. People were all in the park exercising, but we were there to support everybody in need. So the park staff There's the park officers, a social well-being team. You don't call them paraspecialists. Social well-being team. He has a uniform on right now. Stand up, Felix, please. All right. They tour the park from 7 to 12. They have their own IDs, right? They have their business cards. They have their own phones.
And I have the phone is in my bag.
Oh, the phone? He has his own private phone. They have walkie-talkies, right? So they can communicate with the park officers. We do not get the police involved, right? And it's tailored for Fort Greene, just for us, right? And we have our own email addresses. Felix created all the resource lists for the community.
Yes.
If you see, we have our own flyers. Please donate. Here's Q codes, right? We need clothing. We need Metro cards for people. We need to get people cell phones because people need to connect with their loved ones. I know I'm wrapping up, right? And also we have a community advisory committee. We want to have the people. It's about the people for the people type of response. We have the restaurant owners. We have people, the neighbors, everybody supporting the pilot. And I guess that's about it. And so you can introduce Felix now.
Amazing. No, Christina, that is what we need in my council district. Isn't that amazing? Isn't that amazing? Let me tell you, that's what we need in Council District 3.
Thank you.
That we don't have. Because what we don't have and what we don't see is people all over the city. I'm speaking about in my council district. Every day, folks are asking, where are the people out on the street proactively offering assistance? And yes, they have homeless outreach teams, but it's not like this. It's not like that. Well, tell me, you said it was privately funded. Is there any city funding involved?
Not yet. But we're getting more money, a lot of private, we talk about this, people, reporters want to interview us, they want to come to the park, NPR, all these, in New York Times, everyone is the ones to get involved in this. We will take city funding, but just allow us some flexibility.
There's strings attached.
We want to do what's right for the community, but we don't want our hands tied.
There's strings attached with that city money. Those agencies. How has the city responded, the various agencies, how have they responded to the model?
So the good thing about it is when we first crafted this model, we went directly to the 88th precinct and said, we're here. We understand we have to work together and coexist, but here's our team. We're taking over the Fort Greene Park. We have it. If you have any concerns, when you see us in the park, let us do our job.
Isn't that great? Really great. Felix, tell us about some success stories you've seen with this model. And I'm also curious to know, what resources do you have at your disposal when you're approaching folks? Because that's what we hear from outreach workers, is that they could come up to someone 100 times, but if they don't have housing, tell us about those challenges you're experiencing too, in addition to the successes.
So here's the thing, homelessness is everywhere and it needs to be addressed, and if you come empty-handed, you cannot get a connection, and the important thing to note is that kindness and compassion has to be at the forefront of everything, specifically around outreach, because again, a person might not have ate that day or the day before, the person might have, the person might not have slept, person might be overtly in crisis or becoming unwell and so forth. And so it takes removing away any kind of judgment and just approaching with kindness and compassion at the forefront. Again, because I'm trained as a peer specialist and specifically around intentional peer support and so forth, emotional CPR and whatnot, I try to first just see how that person's day is going. Is there anything? Have you eaten today? What are your plans for the rest of the day? So on those initial contacts, people are hesitant to engage because, again, they see sometimes that we as outreach workers as sort of the kind of the normal encounter where it's just, we'll take your information, we'll help you, and because that has been the nature of a lot of contacts for some of the people that we support, it has been kind of a challenge. And as such, when engaging with someone, we try to first make sure that they've eaten something that day. at that point, then we have a conversation. I see that you're that you're in the park. Is there anything particular that you like about the park? Are you aware of the resources in the neighborhood, or what activities you like at the park and so forth? And then just try to see what their hobbies might be, what their interests might be, and then just try to connect with them on how they're doing with wellness around COVID and building on the conversation around that. So in our day-to-day, we have resource lists which we provide that actually have resources in the area and also collaboratively as well close by. And so we try to connect them with socialization resources, such as like referring to clubhouses and or connecting to peer support groups, and then also trying to just see where they're at as far as housing. So in our day-to-day, there's a couple of success stories that we've had. Because homelessness is when a person is unhoused, it can be a long-term process to actually become housed. And in that regard, in our work, we have come across people that have been homeless for 5, 10, 15 years and so forth, that because of safety concerns, they would rather be either unhoused and kind of back and forth in that regard. And so the success stories have been that we have secured a safe haven placement bed for someone who had actually been in and out of a domestic violence relationship and had difficulties with managing sobriety. And in doing so, she was able to connect and also work on her wellness as a result of being in a stable environment where she can have a curfew of 72 hours. That's what safe havens afford, as opposed to shelters which mandate that you have to be in by anywhere from 8 to 10 nightly. You can a person can kind of go about their day, meet their family, stay in the community connected, and work on themselves however they wish. And because those services they're not mandatory on site, a person can work on harm reduction if that is their desire, and just be able to be in a safe environment where they know that they can turn the lock, turn the key, and they have a place for themselves that they might not have had before. And there's been other successes where we provided finances for IDs. That's something that has been a big kind of obstacle. Also connecting people with letters for identities to state identity, because again, to get a state ID, you have to have a letter from a community-based organization verifying who you are. And also we've acted as advocates for persons who are in shelter, helping them along the pathway to securing vouchers. And we've also been providing clothing as needed on an as needed basis. And should anybody be hungry, we afford them snacks or opportunity for a meal. And we build the connections in the community so that people are able to feel as though they are a part of the community, not on the outskirts of it. Because I know that for myself, the experience of being without a home was just demoralizing, dehumanizing. I felt very isolated, and as such, I didn't know that I was unwell by society standards, because I thought that I was forgotten. So in that regard, the successes can be attributed to can be attributed to not just resource connections, but moral successes and community-based successes. Because again, when we engage with someone and bring them out of despair and desperation, they're able to feel as though they can continue to contribute. And that's what we should be focusing on, is trying to build those connections with people so that they don't feel as though they are without choices or opportunities. And so the successes have been, not without a little challenges, because again, it is difficult to go from being unhoused into a housing situation where in the safe haven, where you have some rules, so it is a little bit challenging, and sometimes because of issues with substances or alcohol. So we've been actually supporting people as they navigate that to having a safer consumption of alcohol or so forth. So I'm trained in actually harm reduction and also Narcan administration and CPR and so forth. So again, like we speak from a place of having the experience to be able to help, and also always continually educating ourselves with these approaches, so that when we are engaging, the success is actually very transparent in how that person carries themselves thereon. So again, where the policies fail, we achieve connection. So
Thank
thank
you.
you.
Great.
Can we show the video?
Sure, go ahead.
The video?
Oh, we have a video. We're gonna see a video.
So this is like a snapshot of one of our social well-being team members. They call social well-being team members. Go ahead. Okay. Her story, her experience.
It's a very
Her name is
rewarding
Mo.
job to me,
Oh,
'cause I like
volume.
helping people.
And it started all
My
over.
job basically is to go around asking and helping anyone that needs.
Wait 1 second.
Yeah.
We'll
Start all over, yeah. Let me the volume.
We're gonna switch to Mac next time.
There's no volume.
Maybe
You might have to put the computer to
That's
speak.
what
Yeah,
I was
yeah,
thinking, but I was like, where is the sound?
Oh, there he goes, right there.
Thank you.
The volume.
It's a very rewarding job to me,
Higher,
because I
higher,
like
higher.
helping people.
Excuse
My
me?
job basically is to
Oh,
go.
Okay.
so sorry.
I have one quick question. Does anyone have the sign-in paper pad? Thank you. Awesome.
Pass it around, please, yeah.
You can give it to me at the end or one of the volunteers who I'll introduce later. Is it good? Are we ready to go? Thank you, everyone.
It's a very rewarding job to me, because I like helping people. My job basically is to go around asking and helping anyone that needs our help. That's why we're called a social well-being team. We're not allowed to kick them out the park, tell them they can't use, but what we can do is ask them if there's any help as far as their homelessness and their substance abuse, about putting them in detoxes, putting them in shelters, and whatever they allow us to do. You say this what you want, I can make it happen. When I see them passing through, they like, hi, and I'm like, hey. And I seen a guy that I work with, and one day he finally came to me. He's like, could you please help me? I was like, help you do what? He's like, I really need somewhere to go. And I said, you serious this time? He said, yes, I am. I really need to go in, because whatever his problem was, I said, I got you. I don't let nobody hug me, but I let him hug me because I know it was genuine. And he said, I'm staying, and thank you so much. Sometimes all they want is somebody to talk to, and maybe they really do need help. They just don't know who to ask. You have to have compassion with this kind of work and understanding.
And just, I note one more comment, I'm sorry, I'm hogging up the
Oh, I
front.
got more questions for you,
Okay,
Christina.
great. Sorry.
Go ahead.
So
It's a
yeah,
very
so we,
rewarding job to me.
oh,
'cause
you
I
gotta
like-
turn it off, yeah. So yeah, so even like we had an incident in the park with one of our social well-being team, like he lived in the community, so he knows how to code switch, because code switching is very important, right? And so there was a fight in the community between a boyfriend and girlfriend, or a husband and wife, or whatever, and he was able to break it up, right? And they came back the next day and say, oh, you're the peacemaker. So now they call us the peacemaker.
I love that.
Great.
Christina, are you personally in the part? Are you like working on the project? So is there like a team leader or a captain of this effort?
Yeah, we have like Fountain House is working with us now as the supervisor. Fort Greene Park Conservancy is doing the administrative work, and the parks is also involved too. They help us with the, locating people in need in the park.
That's
Support.
great.
I just designed it. That's all, basically what I did.
That's great. I'm intrigued by something you said earlier, that if you got a city contract, it would restrain you. Talk us through that. What would that mean for you, and what red tape and bureaucracy would be hindering your efforts?
I don't know. That's the conversation we can have next week at your office. What time do you need?
Love it. Best answer yet.
I'm ready.
Let's do it.
Excuse me, and did you bring checkbook now.
Yeah, exactly.
And don't forget CCIT wants money. There's $55 million for both of us.
So that's my next question, Ruth, about the budget. You've been
Someone else's budget, not your personal budget, yes?
Yeah, you've been at City Hall a lot the last few months, advocating for more funding. Tell us what the ask is and specifically what you're pushing for in the budget.
Sure. I mean, that might be good if we had, well, it's probably too much of a pain to put the slideshow up. But it's,
We can do it.
could we? So we have the
We have
last
time.
few pages, request one,
This it?
request. You want to do that?
The slides. Where is Jordan?
It's okay.
Is this it?
Oh, yeah. Flip to towards the end. So, I was alluding to this before when you want to talk to your legislators. Right now, we're in budget season. The council member could tell you much more about that, I am sure. But we are at the precipice of getting a budget passed. Right now, that budget calls for $55 million for a non-police response, which sounds amazing, right? It wouldn't take care of the whole city. We can talk about that in a moment. But still, it sounds like a nice amount of money. But it's going to go to the Be Heard program. And we are not happy with that. I did not really enumerate the problems with it in a very organized fashion, so I'll do that really quickly. So it is co-sponsored by the police. That's a problem. Police still respond, I did tell you this, more than 80% of the time. That is a huge problem. It goes through 911. That's the police. That's a huge problem. One of the the three people actually, response team, two of them actually are emergency medical technicians who are employed by the emergency medical services of the city of New York, which have been part of the problem. They have been working hand in hand with the police. That is a huge problem. The program is only available 16 hours a day. What kind of an emergency response is that? Oh, sweetheart, you'll just wait a few minutes for that crisis, would you, until Be Heard opens up? I mean, that's not how crises work. They don't work on a clock. The other problem is that while they are getting better, and we will give them their due where due is to be given, they have gotten to the point, at least the last time they gave us statistics, which mind you was 6 months ago, so that's a huge problem too, that we are a city agency that has already been funded but is not accountable to the taxpayers because it's not giving us the statistics that we need. But when they last provided us with statistics, they were saying that the response time was an average of 14 minutes, which is not bad, but it also is not the average response time for other emergencies in the city, which is 8 to 10 minutes. So that is something that we are also opposed to. So those are the main flaws. The training is not spelled out in any kind of way. It's not trauma informed as far as we can tell. And there is very little metrics for monitoring. There's no role of peers whatsoever. And also, there's no role for the community. What we say with the CCIT NYC model is that it should be run in the various communities by the relevant community agencies that have their finger on the pulse of the community, that literally speak the language, literally and figuratively, of the people they're serving. And for that matter, they may know Johnny.
That's
they
right.
actually know Johnny because they live with Johnny. So I think that's a little bit of sense of things. So request number 1 says, ask the City Council to enact into legislation the CCIT NYC proposal to create a non-police, peer-driven mental health crisis response that would be open 24/7, that is available in the community, that has a heavy role for peers, that will provide trauma-informed training, that will be accountable to the taxpayers, that does not involve the police. Request number 1. Flipping to request number 2, if I could ask you to do that. Specifically, asking the city council and the mayor to allocate the proposed $55 million to fund the non-police response, not to fund the Be Heard program. And request number 3 is a general statement, which we've said before. You really can't talk about a crisis response without ensuring that we have real mental health services in place. So that's what request number 3 is about. Make sure you have non-coercive voluntary services in place. And the last one, request number 4, is that you also make sure that the city council and the mayor reject the portions of the mayor's subway safety plan that tries to forcibly have individuals who are homeless, perceived of as having mental health issues, potentially have mental health issues, potentially perceived of as the EDPs, the emotionally disturbed persons, cannot be forcibly exited from the subway system. And to the extent that there's a program in place in the subway plan, which we are cautiously optimistic about, the SOS program, that's very strongly, closely monitored by city council. So those are my 4 asks. We can make this available to you, and most importantly, if this is my main plug today, I've asked you to write things down, you ignored me, but this one you're going to do, right? I can see all of you, right? But this one, okay, not you, I know. But this is key. Today, in a few hours, when I get back to my office, we're going to go live. It's not going actually directly to you. I was going to say, watch out for your email boxes. But we have targeted a number of city council members and the mayor's office to tell them exactly this. So you're going to go on either one of 2 websites. NYLPI.org, that's my organization, New York Lawyers Public Interest.org, or CCITNYC.org. The only reason I told you mine is because it's going to be on there first. But it will, only because we're doing it. But, so it'll be available this afternoon, but by the end of the night, it'll be available on both of those, so if you only want to take one of them down. It literally takes a moment. It's one of those really cool, high-tech things. Click, and you've sent a letter to key city council members and to the mayor to say all of these things. So please, please, please do that and pass it around to everyone you know. It's key.
Thank you so much. Thank you. So we have time for questions, and while the mic gets passed around, I want to ask Ruth, what reason is the city giving for not wanting to have a separate phone number or something other than 911? Like, what's their stated concern about it?
Well, the last time the city actually engaged with us on this, it was then at the Thrive agency, which has morphed into the city's mental health, community mental health department. Susan Herman, then the head of Thrive, said, well, this is a pilot. It would not make sense to invest in putting another number out now during the pilot. To which we said, among many things, penny wise, pound foolish, might have been one of the things we said. But we said there are plenty of numbers that can be easily set up. If the one that we remembered talking about that was really a citywide number, the moment that 9/11 happened, the city, and it was the NYPD, set up a hotline number right away that you could call in. It's not that big of a deal, so we encourage that. But more importantly, and here's a moment to talk about something you might all have wanted to hear a bit about, and I'll give you this much on it. 988, sounding familiar, right? So there's this federal program that has a hotline for suicide and mental health issues known as 988. The state has passed legislation saying, yup, we're bringing it here. It's to go online in July. What could be better? It's another number, and that's part of the CCITNYC proposal. So maybe the short answer, council member, is heck if I know why they won't do it differently. And I've learned from people who've been involved in the drafting of the Be Heard program that they never intended, even though that 988 has been talked about for a long time, never intended on putting it together, and I don't know why. Ridiculous.
I can tell you, in my experience, what we need is a person with a name and a face who we can contact and work with in the neighborhood, not just a hotline. That's needed too, but we need a team in the neighborhood that we can communicate with and that the community knows. That's what we also need.
Totally.
So
I'm sorry, may I just, 1 second, just to be clear? So 988 is a hotline. It is coming. It will serve that separate function. But what we're saying is the whole day shouldn't be wasted. That would be the perfect number to tell everybody to call. And one of the functions of the 988 people, after they're also very heavily trained, would be to refer crises to the CCIT NYC model.
That's great. Absolutely. Okay, let's take some questions.
So, can people, I can't tell if this is working, is it?
Yep.
I'm just
Yeah.
loud.
She's just loud, that's right.
So we have someone with a question. If you're not loud, I'm happy to ask your question. I'm really loud.
And stand up if you don't mind. Could you?
Here we go.
So this works now? You can hear me?
Yes.
Okay, I wanted to direct a question at Felix. So I'm really happy to hear about the successes of this program, but I'm wondering about areas for growth, especially from an abolitionist perspective. So I'm wondering if there's anything that you would add or change about the CCIT response, such as maybe parts that are still acting in the interest of the prison industrial complex, or things that are missing from the program that you wish were part of it.
Okay, so when I said abolition, I meant both psychiatric and also prison abolition. Again, I feel that persons should be able to make the decision for themselves whether they want to enter into treatment, and it should be non-coercive. So, as a result of that, I think that more awareness should be made on the actual traumas of forced coercive treatment, so that persons can go ahead and try to, so that the community itself can actually learn how to support people. I think that when we talk about abolition, we leave out the framework that our community needs to also do its part to help support people who are in need of addressing their vulnerabilities. So I think that framework sometimes gets left out of the conversation. So looking at when those touches to the criminal justice system, looking into transformative justice and so forth, and restorative justice, so then that way people don't have to get that that scarlet letter of justice involvement. I think for me, as a formerly incarcerated person, I use that language. I know that it might not be PC, but for me, I have to hold space for everyone who's ever had involvement. And with that regard, I think that we need to start looking at how community should be doing more so to support people. A few years ago, there was a big push for mental health first aid, and now you don't really hear about it anymore. So again, mental health first aid has morphed into different demographics now. Before it was just mainly adult and children. Now it's elderly, war veterans, and so forth. And I think that calling for more trauma-informed care, and also looking into getting more acceptance for creative arts therapies as a tool as a therapeutic intervention, so that we can actually have a trauma-informed workforce that actually looks at people from a trauma-informed lens, that doesn't direct people into what might be coercive psychiatry. So again, I am not anti-psychiatry per se, but I do feel that there are way too many factors that limit a person's encounters with mental health treatment that is respectful and dignified, and because of differences in insurance, ethnicity, and so forth, people get different opportunities to regulate their mental health as unfortunately, and that's the reality, that we need to make the mental health system parity across the board, and also look at trying to build on that whole momentum of New York Health for all, Medicare for all and so forth, so that we can go ahead and actually have a workforce that actually serves people from a trauma-informed perspective, and actually is acknowledges their dignity and humanity, and not so much looks at punitive or carceral interventions. Thank you.
I just want to make one clarification. There's two different models up here. One is CCIT, which is Correct Crisis Intervention Today, which Ruth is advocating for. It's a non-police response model, peer-driven model that CCIT wants citywide. The PCIT is person-centered intervention training, which is definitely located just in Fort Greene Park, small model in Fort Greene Park, in which she represents.
And also just to, I think, use the council member's words, the PCIT program is this amazing proactive model, whereas the CCIT proposal we have in mind is you got that crisis already, what you gonna do? Citywide is our goal. This gentleman who...
Oh, we have one back here, Ruth.
Oh, okay, sorry.
And then, well, here, she was first, and then we have a lineup. I got it.
Oh, a lineup, go ahead, so we define.
So my question is basically regarding your training. You say you had 35 hours training towards these models. Have you ever thought about bringing those trainings to staff at agencies? Like, I run a program as a residence. Would I be able to outreach you and say, I would like you to train my staff on these trainings?
I would love to. I'll give you my business card.
Please, right here.
Okay.
It's great. Maybe an email could go out to everyone who's signed in
Oh, yeah,
with their contact info. Maybe we
Yeah,
could do that.
okay, cool, thank you.
Great.
Okay,
Is it good? Okay.
okay.
So my question is for Ruth and the program you're advocating for. I just had a question about your definition of like criminalizing behavior, because most of the people we're engaging are committing crimes by default. If they're homeless or engaging in substance use or whatever people are trying to, deem inappropriate behavior, even though I think most people in this room think that's a nonsense stance. And I want to know the line you're drawing in that regard, because, you kept saying that you were going to help people in non-criminalizing situations, but I think by definition, in a clinical sense, that's most people we're engaging. So I don't get what your program is doing.
I really appreciate that question. It's excellent. And, when you're trying to get things across, sometimes you leave out some important details. So I'm really appreciating that question. So we have thought long and hard about this before the council member came on to the council. I'll make that very clear. There was legislation pending that suggested essentially what you're saying, that police is this exception that could come in anytime there's anything with some vague definition of criminality. So we say there's a very limited circumstance, and you can look at our model online. It is only when there is imminent harm of serious danger. So we're not talking about someone who is homeless, who is trespassing, who is doing anything of that sort. If there's a threat, and it's actual threat, and you have an actual weapon or a physical threat otherwise that is a cognizable threat, that is the rare instance when the police can be called. And as I like to think about it, that would be where police would be called in any other matter. So for your much more common crisis that involves none of those dangerous aspects, serious dangerous aspects, that's where it would be a wholly non-police response. It's probably a much longer discussion, and you and I can engage in it, or others can, but I hope that gives you the sense of what we're talking about.
Good morning. My name is Oliemi. I'm representing Hardshare Family Services, St. Vincent's. I just want to say that I love the premise and mission of your agency, and I wanted to know, were you willing to extend your services to different landscapes of New York City, like the train stations and buses, because there's a number of unhoused individuals there that need assistance?
I think that's a great question. I myself, I know I'm not perfect. I always reach out to other people to learn, to be better myself. If I have other contacts and other people who can support me and help me with the training, I would definitely do that.
I think it's because this is such a small initiative, we're still looking for collaborative partners and so
Yes.
forth, so we can scale it up. But again, that comes with funding and also allowing for professional development of the peer specialists to continuously train in modalities that are necessary.
Maybe St. Vincent's has some money. Just
There you go. We'll make a meeting with you next week, too.
My question is mostly for Ruth. So you mentioned this program in Oregon. So Oregon has incredibly different demographics, lifestyle, population, et cetera. Do you feel that there would need to be really big changes from what they're doing for what New York would have?
I would say yes and no. So what we have in mind is something that is to be culturally sensitive to the various communities. So that means in Oregon, perhaps you would not have the need for someone to speak Haitian Creole, to know about the customs of a Latino community or something of that sort. So in that sense, things would be different here. Would the basic model need to be different? Non-police, involving an independent emergency medical technician in case there's some sort of a medical involvement, along with a peer, being there all the time, et cetera, et cetera. Would that need to be different? I don't see it. And again, who cares what Ruth thinks? You know who else doesn't see it? Los Angeles, San Francisco, Denver, New Haven. Those are all the cities that are smartly hopping on the bandwagon. And that's why Cahoots is such a presence, because everyone's going to Cahoots and saying, wow, how'd you make this work? Yes, I know we're not Eugene, Oregon, but what difference does it make as long as you take into account those culturally different ways of doing business and you build it to the kind of scale? So that's my very emphatic response on that. Different from the cities, I will say.
So let's take one more question, if that's okay, and that, because we have to do we're going to do a mindfulness exercise by Felix. So maybe we'll do 2 more questions, because I see 2 more, and then we'll do a mindfulness exercise.
Okay, I had to write it down because it's a lot, but I guess this is for Christina and for Ruth. How would I know if this is in my precinct? Because I work near the 40th precinct in Mount Haven in the Bronx, and that is considered the most active precinct in the Bronx. How would I know if this model is actually in my precinct, and how do I request this model if I have issues?
So I'm embarrassed to say that I don't know all of the precincts that it's in. If you went on the website for Be Heard, capital B hyphen HEARD, you would find out which are the precincts it is in right now. But to be clear on the second part of your question, you can call till you're blue in the face. You ain't getting it. You got to call 911, and they, in their wisdom, would be the ones to refer you. Again, assuming it's even in your district. Okay, so just to clarify that part.
Okay, last question.
Thank you. Anyone else?
Okay.
Right here.
Right here.
Right here.
Oh, right there. Okay.
Thanks. Thank you all so much for describing the really important work that you're doing and trying to get the city to do. My question is about the feasibility given the Adams administration, which is, he's a cop, and his administration is filled with people who like cops, and what he wants is to fund more money for the cops. So how are we going to do it?
So I think he's the perfect person. Why? Because if the cops aren't doing this, and please hear this with a slight sarcasm in my voice, they're free to do all the other things Mayor Adams would want them to do. I'm not so sure we'd be happy about that. But the point is that we are not touching the police and all their other functions. If anything, they will have more opportunity to do other matters, which again, that's off onto the side. And I think what's also worth noting is if you interview cops, and not that I have done it very formally, but on an ad hoc basis, This is not what they want to do. This is not what they went to the academy for, to de-escalate mental health crises. I will just say, by the way, there's just so much to say, but real quickly, if you go on our website, one of the things that my office did was litigate. I mean, we shouldn't have had to. We had a Freedom of Information request to get the body-worn camera footage of the police officers who killed individuals. They refused to give it. We had to litigate. We won, and we got the footage. And that footage is on our website, and it's easy to digest in form. It's under the heading, "A Picture Worth 1,000 Words." It is just a profound statement as to why police are not the right people, which I know is a little off from your question, and you want to move on.
Thank you, Ruth. And before Felix does the mindfulness exercise, let's give a round of applause to our amazing panel. We're so lucky to have folks like you in New York. We really are.
So hello everybody. So I wanted to, this is something that we use actually in our mindfulness workshop that we do every second and fourth Friday at the park. Oh, sorry. Could everybody hear me when I just, okay, awesome. So there's a practice that we incorporate called 4-7-8 breathing, which is actually a technique for deep relaxation conceived by a Harvard-trained medical doctor and founder of the Arizona Center for Integrative Medicine, Dr. Andrew Weil. Many use this counting technique to manage stress and anxiety through controlled breathing. Specifically, it involves inhaling for the count of 4 seconds, holding your breath for the count of 7 seconds, and exhaling for the count of 8. So basically, to start it off, you would take one long deep breath and then push all the air out, and then you would start the count. So I'm going to go ahead and I'm going to be counting along, and then I'm just going to do it for like a few counts, and then from that point on, I will try to do it for about a minute. So it's interactive. So go ahead and take a deep breath, the deepest breath you can, and exhale. Now breathing in through your nose for 4 seconds. Now 1, 2, 3, 4. Hold it for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Now breathe out through your mouth for 8. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in through your nose for 4. 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Now breathe out for 8. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in through your nose for 4 seconds. 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Breathe out through your mouth for 8. 1, 2, 3, 4, 5, 6, 7, 8. Now do it internally. 1, 2, 3. And go ahead and do one last complete cycle. Breathing in through your nose for 4 seconds. 1, 2, 3, 4. Holding for 7. 1, 2, 3, 4, 5, 6, 7. Now breathing out for 8. 1, 2, 3, 4, 5, 6, 7, 8. And thank you. How does everyone feel after that? So This is actually something good for, this is actually something really great for me because I have issues with closing my eyes, so meditative practices are kind of difficult for me. So I'm able to do this without actually having to do so. So it's actually a safe exercise that anyone can do, regardless of with eyes closed or not. Thank you.
So relentless as I am, I'm just going to say I know what this did for you. It got you in the place to go on my website and write to those legislators.
And to donate.
And thank you, Felix.
Thank you, everyone, and thank you for everything you all do. Have a great day.
Thank you. And a big round of applause for the council member.